Okay, good afternoon. My name is Eliza Bowling. I am the Public Health Advisor for the National Indian Health Board. And this is the Tribal Environmental Health Summit webinar series where we will be talking about health equity today. Our speaker is Miss Carrie, and she has been so gracious to provide a presentation for your viewing. If you have questions, please feel free to put them in the chat. I will ask them towards the end of the presentation, or at the end of the presentation, you're free to hop off mute and ask questions as they come. But without further ado, I will let Ms. Carrie have the field.
Hi, everyone. It's really great to be here today. So I am Carrie Field. I am a senior policy analyst here at the National Indian Health Board. My background is in public health. I have an MPH. My portfolio area includes public health policy and health equity. And so I'm really happy to be here today to talk about health equity, environmental justice, and indigenous determinants of health, and kind of how all of these different things are connected. So I am not Native myself, so I'm not obviously going to be speaking as a cultural expert, but I can speak to the importance of culture informing the work that we're doing in environmental health spaces. So as we kind of get started thinking about why this conversation is important, does anybody want to drop in the chat your guess for what percentage of the world's biodiversity is protected by Indigenous peoples? Anybody have an estimate on what that percentage might be? Just to check to see if everyone's awake. So Indigenous peoples are estimated to be stewards of the biodiversity, caretaking 80% of the Earth's variety of species, while at the same time disproportionately suffering effects of toxic and degraded environments. And so that's kind of where we want to focus our conversation today, thinking about the disproportionate impact of some of the harms, the environmental harms that we've seen, but also seeing some of the opportunity as caretakers of so much of the Earth's biodiversity and the important role that Indigenous peoples play as stewards in environmental spaces. So a lot of kind of where this conversation begins is in general, just thinking about environmentalism as a movement in the United States and around the world, and kind of some of the common things that come to mind when we talk about environmentalism, right? Might be discussions about climate change, about pollution and toxins, a lot of discussion about plastic and recycling, fossil fuels and the impacts that those have had on climate and environment, and kind of shifts towards renewable energy, and then the policies that kind of undergird all of those. And those are important discussions, those are important pieces, but in kind of the broader environmentalism movement, we can sometimes lose sight of some of the pieces that are really important about how those different pieces impact different groups disproportionately, and about whose voices are really being heard in those conversations. And so that's where we really want to bring in kind of the discussion about environmental justice to look at those other pieces as well. So a definition from the Environmental Protection Agency of environmental justice is the just treatment and meaningful involvement of all people, regardless of income, race, color, national origin, tribal affiliation, or disability, in agency decision-making and other federal activities that affect human health and environment, so that people are fully protected from disproportionate and adverse human health and environmental effects, including risks and hazards, including those related to climate change, the cumulative impacts of environmental or other burdens, and the legacy of racism or other structural and systemic barriers. And I would include in there the legacy of colonization, and making sure that people have equitable access to a healthy, sustainable, and resilient environment in which to live, play, work, learn, grow, worship, and engage in cultural and subsistence practices. And that piece about cultural and subsistence practices are especially important when we're talking about the tribal space. So all of these are important pieces, and you can kind of see encapsulated in that definition, there's kind of a reference to that there are these structural and systemic barriers, the legacy of racism that's been very impactful in in how environmental harms have been distributed across society, that it has not equally impacted all people equally, but that there is a severe disproportionate impact on kind of where different types of risks have been located in physical space and who's borne the harm from that. And so that's kind of an important piece around environmental justice, is recognizing the history of harm and also how to change that going forward. So making sure that there are the right voices in the room, that policies are really considerate of the health impacts of different activities that could impact the environment. And making sure that there is not only a healthy environment, but there is equitable access to the kind of environment that people need in order to live full and healthy lives. So we're going to start looking here as kind of a little example. The Havasupai tribe live near the Grand Canyon, or in the Grand Canyon, and they have been there since time immemorial. So they have very long and deep connections to the water, the plants, the animals, and the geology throughout the Colorado Plateau there. And so the tribe recognizes that the area has specific strengths and recognizes deities that warrant offerings, that there are really important aspects of the relationship to the land for the tribe. And so the land is very much integral into belief systems, including kind of the idea that every living plant and animal has a role on this earth and a specific spirit that should be protected. And really central is the idea of reciprocity. So the reciprocity with nature is integral to survival, not only for the ecosystem, but for people also. And then one part of that is water, right? So water is essential. Even the name of the Havasupai people, it's the people of the blue-green water. It's very integral to identity. And so the tribe's existence and belief systems are at risk of very serious harm that might not be able to be mitigated if the water were to become contaminated through uranium mining. So there has been a lot of uranium mining that's happened in that area. And so there's been also a lot of advocacy around that and concerns that are brought up about the environmental impact. So one of the mines in the area that's very close to the tribe is the Pinyon Plain Mine. It's rich in uranium and copper, and it's located in an area that the tribe understands or calls the Sacred Meeting Corridor. And so the tribe has been very outspoken against the mining in that area, launching lawsuits, injunctions, protests, letters to various agencies, kind of every avenue that is possible to try to speak out against the potential harm from mining in this area. And so a lot of the concerns have focused around the impact on the land for cultural purposes and for health, recognizing that uranium mining can cause death and destruction to the waters, to the existence of their life and traditional practices. And so a little while ago, the US government did enact a 20-year mining withdrawal, so banning any new uranium mines on federal lands around the Grand Canyon. However, there was an exception in there in that any existing mines would be grandfathered in. And so that would include the Pinyon Plain Mine. And so in this discussion where the US government is still somewhat supporting mining in the area, the tribe is very much against any continued mining. Part of what is happening there is a difference in clashing worldviews. And so you can kind of see an example of that here. So kind of starting with the quote on the bottom there is from one of the executives of the mining company. So he says that the Pinyon Plain Mine is only about 17 acres in size. It's a small underground mine, so there will not be a big open pit or other significant disturbance. And once the mining is completed, the Pinyon Plain Mine site will be fully reclaimed and returned to its former use, including recreation, forestry, wildlife conservation, etc. So even if you're setting aside that there's a clear conflict of interest in the mining executive's perspective on this, it's a very narrow kind of view on what the environmental concern might be. Whereas one of the Havasupai elders has said that we have a belief system that they don't understand. In our stories, that are where the mine is located is Mother Earth's lungs. So when they dug that mine shaft, they punctured her lungs. And so that's a really vivid example of just how the difference in worldview can change how you're understanding the activities and events that are taking place and the significance of them. And so you having any mine at all there is a problem. It's a really kind of vivid example about how the deviation from equitable coexistence between humans and non-human beings is inconsistent with the foundational understanding of many Indigenous cultures. And so that's kind of one of the pieces where we want to dig into a little bit more about where that kind of conflict in worldviews is coming from and what an Indigenous perspective might be and what that can contribute to the conversations around environmentalism and environmental justice. So one piece that we can kind of use to think about this a little bit more is the model of the Indigenous determinants of health. This is a framework that was adopted by the United Nations Permanent Forum on Indigenous Issues, and the National Indian Health Board was a co-author on that report. And so you can see in that green piece of the circle there, that whole green piece is about the health of Mother Earth. And so you can see that the environment is hugely important in terms of the factors that are going to impact the health of Indigenous peoples. And this is true both in terms of risk factors of things that have the potential to cause harm or have historically caused harm, in addition to protective factors of things that we know are bringing health and healing. And so this is a really important piece of this framework and in addition, we kind of look at a little bit broadly defining environmental justice issues. They really are integral to Indigenous determinants of health. So these yellow circles kind of show all the different places that the land and issues around environmentalism really come into play. And so this is an important discussion when kind of just considering holistically health for tribes and for Native peoples. So looking a little bit more at the health of Mother Earth, it's really kind of understanding this idea that Indigenous peoples and communities have been in deep and meaningful relationship with their surroundings for as long as they've existed. And that concept of relationship is really key. And I think one of the pieces where you see some of that divergence in worldviews that non-Indigenous peoples might not fully understand the concept of being in relationship with your surroundings, with the environment, with the lands and waters and other living beings. But it is a really core part to having a really holistic view of health and understanding of the world around you. Because the physical, mental, emotional, and spiritual health of Indigenous peoples is intrinsically linked to the health and access to the source of life, so in the earth. Land, culture, and language are powerful tools for healing, and they are all very related to each other. And Indigenous practices for responsible harvesting, including management of flora, fauna, and waterways, and spiritual practices to maintain the balance of that relationship between people and the environment. Those responsible practices have been ongoing since time immemorial, but have eroded since colonization from forces of supremacism and capitalism. And so as a result of that, most Indigenous peoples have suffered an increased loss of access to physical resources in the environment, including fresh water, hunting, fishing, and gathering grounds with intact ecosystems, and Indigenous food systems. And so those impacts of colonization have led to environmental dispossession and have eroded those relationships that are so critical between Indigenous peoples and the environment. So I'm kind of looking at an overview about how this ties into health and health equity is that the health of Mother Earth is really critical for relationships, for connection to spirituality, to community, to culture. It's right in the center of all of those. And those are the connections that keep people healthy. They're extremely protective. In addition, it has a huge impact on access to traditional medicine, traditional healing practices, food sovereignty and nutrition are really critical. And it comes especially when you have conversations looking at the prevalence of chronic disease. One of the really promising routes towards eliminating chronic disease for tribes is in enhancing food sovereignty and nutrition through re-enhancing indigenous food systems, which we'll talk about a little bit more in a second. Clean water, always absolutely necessary for healthy people, having safe places to live, play, worship, to conduct ceremony, making sure that all the places that you are living are free from pollution and toxins and contaminants in land, air, or water. And so the health of Mother Earth is really the health of the people. So looking at indigenous food systems, so indigenous foods are central to the health, well-being, and cultural integrity of indigenous peoples worldwide. They originate from local environments. Indigenous food systems can include farming, wild harvesting, hunting, fishing. And so those food systems include kind of all of the different components of that. So the social cultural meetings, the acquisition patterns of how you're getting the food, how you process it, use it, and then the health and nutritional consequences of the people that are using these foods. And those relationships that indigenous peoples have with their unique food systems and the local ecosystems also encourage practices and values that perpetuate healthy communities. And so those can be really, really powerful for protecting and promoting health. Indigenous knowledge and food systems have been developed and nurtured over thousands of years with ecosystems, communities, and cultures. So as we're talking about promoting food sovereignty, it's really about kind of going back to the roots and tradition. So the land is also really important as a connection point for culture as and traditional lifeways. So indigenous knowledge systems represent kind of the huge breadth of knowledge and practices and ways of being human in relationship with past and future generations, current indigenous communities and environments. And so that knowledge is passed on intergenerationally in complex and meaningful ways. Those traditional lifeways and that connection can be eroded through over harvesting, climate change, losing access to your traditional lands, or through regulations or destruction of those lands and the natural resources that are really integral to those traditional practices. So indigenous peoples are resource rich, but financially and politically limited. And so with the erosion of those indigenous lifeways through the impacts on the land and environment can continue to be vulnerable. Another example of the importance of land for health is just traditional healing and medicines. So the health of the environment is really essential to promoting health and healing ways of indigenous peoples who have developed complex healing systems that continue to be used, often referred to as traditional healing. And so those, it can be a tremendous resource for prevention and also for managing chronic diseases and other types of ailments. And those methods have been developed in relation to surroundings and ecosystems within which indigenous peoples exist. And so those practices are also vulnerable if there are cultural, geopolitical changes, like from colonization or if the land is impacted. Traditional healing practices are intrinsically valuable and a global asset and should be promoted and protected in conjunction with the ecosystems that sustain them. And so all of these are examples of why a discussion about the environment and about environmental justice is really incomplete if you're not also talking about health equity and the land and the waters as a really core determinant of health in both making sure that the Mother Earth is healthy is also making sure that people are healthy. And so we need to be really cognizant about some of the threats to that. So the Indigenous Determinants of Health report has this quote that the extractive capitalistic system is underpinned by supremacist belief that the priority of those in power is more important than the needs of those that are less advantaged. And we kind of see this theme playing out again and again, like in the example of the Havasupai tribe speaking out for decades against the mines and then that they're still there, right? And so that belief system and capitalism has led to the overharvesting of multitudes of resources, including animals, plants, or in water. And that's led to other types of pollution, including air toxicity, which has impacted the overall environment across the world. And these processes come at the expense of the environment and the health of people and often disproportionately affect Indigenous inhabitants. And so some of the kind of specific impacts that that can have is the disruption of or decimation of Indigenous food sources and medicines, and limiting access to land and resources. And that has led to a decline in the consumption of Indigenous foods and the social, cultural, and health benefits that those foods provide. And in addition, the kind of that dominant narrative has facilitated a loss of medical practice and the dissolution of Indigenous ways of being well, especially by limiting access to traditional healers and traditional medicines. And then finally, a lack of access to clean drinking water and adequate food remains a key health concern for Indigenous peoples globally. And so those are kind of some of the specific impacts that a lot of the different kind of legacies of colonization have had on the environment and on the people that depend on that environment. So kind of looking a little bit more specifically, here's like one example of kind of what this looks like in practice. And so in Alaska, there's been a lot of concern over the salmon. The salmon population has been struggling for a long time, and kind of continues to be a problem. And so Alaska has kind of looked at several different types of solutions for how to support the salmon population. And recently kind of announced, and actually just about a couple months ago, announced a new approach to how they're going to try to restore the fishing levels in the Yukon River. But there are concerns that the approach that's taken is not really holistic enough, and it's not addressing some of like the really most important causes. So like huge losses to industrial fishing in the ocean and that kind of thing. And instead it ends up disproportionately burdening tribes because it targets traditional practices and subsistence fishing. So tribal leaders have said that the restrictions to subsistence fishing cause an unfair burden for Native communities, severing a crucial link to traditional culture, and that tribal officials were not properly involved in the decision making. So the state officials didn't include them in tribal consultation in the way that they should have. And so the fishing has been restricted since 2008, with total closure since 2021. And that's had a really significant impact on the Alaska Native peoples. The loss of salmon imperils not only food security and off-the-road communities where supplies are crippling and expensive, but also important cultural ties. So a little while ago, we were interviewing, working on a project kind of looking at more in kind of what are some of the key factors that impact health. In that case, we were looking specifically at early childhood. And one of the physicians that we interviewed had recently done a site visit to the programs in Fairbanks in Alaska. And so talking about an area where very few of the villages are accessible by roads, and a lot of the community is dependent on salmon fishing. And so they shared a story from that visit talking about the community. So this community is reliant on salmon for sustenance, and not just for health benefits, but also for the practice of salmon fishing and for the cultural traditions that are embedded in that. So elders would go out and set nets, youth would go out with them and learn about water safety, about cultural tradition, how to catch, how to prepare, how to eat the salmon, healthy living, exercise, mental health. So all these different types of health really embodied in that practice of salmon fishing and the traditional food system in kind of a holistic way. So you have physical health, emotional health, social, spiritual, everything is encapsulated in this practice of harvesting salmon. But as the salmon population in Alaska declined and fishing was restricted, subsistence fishing especially was restricted, and only some commercial salmon fisheries were still permitted to continue. Then those small villages were no longer permitted to fish for salmon. And so the impact on the community was really felt strongly. And so one of the state government food programs suggested a workaround, suggesting that they could fly in salmon into the interior, and then they would be able to have salmon available to them for the nutritional benefits and the sustenance. But that really only addresses one piece of the issue, right? So losing access to the salmon is not just about the nutritional value of salmon, but also about all of those other pieces relating to the culture, to the strength of the community, to family ties, intergenerational ties, all these other things that are extremely protective for the health of the people. All right, so those are the things that build in resiliency into the community. And the resiliency of the culture there, you can't substitute it with boxed salmon, right? So if you're taking away the access to salmon, then you're also taking away time that the youth have with the elders, with cultural practice and passing the tradition, and learning all those other health practices. So all of that kind of changed with that restriction policy. And so unfortunately, that's one of the strengths that's been removed from the community, that the communities are still fighting for to have returned. So restrictions on subsistence fishing force tribes to bear the brunt of the conservation. And we see this happen kind of again and again across the world, that Indigenous peoples are kind of asked to be the ones to greatest sacrifice in the name of protecting the environment, while commercial interests are still ongoing. So there's a lot of other pieces and overlapping challenges to the salmon problem. It's not going to be an easy one to solve. But moving forward, it needs to make sure that there's not that disproportionate impact, right? That the risk and the harm is not falling most heavily on Indigenous communities. So any plan to restore the Yukon salmon must involve native input. So as one of the tribal leaders said, like, if we're actually at the table designing that new future, then maybe there's a chance it can be truly sustainable, right? So it's not just that it's unfair, it's that leaving out tribal leaders and Indigenous peoples leaves out really important pieces of the puzzle in problem solving how to move forward. There is really key knowledge there in the Indigenous knowledge and in the experience that's really important in order to be able to have an effective path forward to conservation of the salmon or any other environmental issues. Tribes' detailed local knowledge can provide insights into how conditions are changing, into the history, into kind of what the real problems are, and paths that we might be able to find solutions. And so both from a rights standpoint and from an efficacy standpoint, tribes always need to be at the table and part of those conversations and making the policy and making sure that they're not an afterthought as policy is being created. So we know that there's a lot of problems. We know that there's a really strong impact for health. What can we do about it? What are some paths forward? So as we're thinking about environment and health, kind of one of the really key factors there is the identity of self and connection to community and land are really key protective factors for Indigenous peoples. And so cultural identity and connection to communities and land are essential elements towards decolonization and reversing some of the effects of colonization, while remembering, re-embracing, and indigenizing living systems and ways of being. So it's a way to move back into Indigenous lifeways and practices that are currently threatened by dominant colonial powers. So restoring cultural identity and community connectedness is a catalyst for addressing discrimination and oppression of culture and resulting disparities. And we've seen successes as non-Indigenous allies and empowered systems and programs come alongside and partner with Indigenous peoples to make sure that those less visible voices are amplified and elevated and heard. And so those partnerships are where we've seen a lot of promise in making sure that that tribes are at the table and that tribal leaders have a strong voice in these conversations. So along with the Indigenous Determinants of Health framework, another kind of framework that we use often at the National Indian Health Board are these foundations of health equity. There's kind of 5 kind of components that we see as being really integral to any conversation about health equity in any context. And they really do apply in kind of discussions about environmental justice as well. So kind of the idea of tribal sovereignty is always going to come first and foremost. It's really important in the environmental space, especially the concept of free, prior, and informed consent, making sure that anything that's happening that can have an environmental impact has been consented to by the tribe. So for example, that mine by the Grand Canyon, right, did not have tribal consent. And so if we really were adhering to these principles, it wouldn't be able to move forward. Tribal consultation is a really important way that that consent is achieved, or that those discussions happen. So a meeting between governments, making sure that everybody is in agreement about the path forward. And there is a legal requirement for tribal consultation from any government agency, any action that could have an impact on tribal lands, tribes or tribal citizens. Resilience through culture is another one of the important foundations. We've seen kind of throughout this webinar the importance of environment and culture and the strong interconnection there. Strong tribal institutions, so making sure that there are enough resources going to tribes so that their own conservation efforts are fully funded, making sure that the food sovereignty has enough support, that tribes are able to take whatever path to food sovereignty that they see is going to be the most beneficial for their people. Tribal empowerment in state and federal governments, making sure that tribes are included in environmental planning and in stewardship, that Indigenous leadership is respected, making sure that that those voices are included, and it's not just states or federal government making decisions and then notifying the tribes, but making sure that tribes actually are included in that process and can contribute their own knowledge and experience and values and perspective and worldview that are going to be incredibly valuable for making effective environmental policy. So another kind of part of that is the co-production of knowledge, which we'll talk about a little bit more in a minute, but that's can be another path forward of looking at collaboration between tribes and non-Indigenous researchers and government agencies, and looking at how we can collaboratively move forward. And then the federal trust responsibility. So the US government has made commitments to protecting tribal interests, including lands. And so there's a responsibility there to make sure that tribes have enough funding in order to be able to do their conservation programs and food sovereignty, but also to make sure that tribal treaty rights are protected and that there is a protection of rights for hunting, gathering, fishing, and accessing important cultural sites. So those all are pieces of the federal trust responsibility that the US government is legally obligated to fulfill. And so really the purpose of all of this is to restore sustainable relationships to land, culture, and communities, including resurgences of Indigenous food systems and community roles and responsibilities to protect the lands and waters. So as the Indigenous Determinants of Health report says, these are necessary acts of resurgence, pathways to reconciliation, and determinants of health and well-being. And I think that that's a really important piece that often is missing from discussions about the environment, is that relationship and reconciliation is really a core component there. It's really the purpose of all of it. And we do see some of these principles that are catching on a little bit more. So the EPA, for example, has a policy on environmental justice for working with federally recognized tribes and Indigenous peoples, and it includes principles listed in that policy, like the importance of tribal consultation for anything that could impact tribes. It says the EPA works to understand definitions of human health and the environment from the perspective of tribes and Indigenous peoples. So kind of they've already proactively recognized that there is a difference in worldview and say that they are committed to understanding the tribal perspectives. The EPA strives to understand culture and communication differences, and to establish common understandings and opportunities to address environmental justice issues, looking at the other perspectives that are coming from Indigenous peoples. EPA recognizes the right of tribal governments to self-determination and acknowledges the federal government's trust responsibility to federally recognize tribes based on the Constitution, treaties, statutes, executive orders, and court decisions. And the EPA seeks to maintain relationships with Indigenous peoples and communities based on mutual understanding and respect. So again, that importance of relationship is really clear here. So these are just a few examples there. I think there's a list of 17 principles in total that are in that policy. But it is something that is promising a step forward. Unfortunately, the policy also includes a statement that it is not legally enforceable. And so it's really a kind of a statement of values, but it doesn't actually necessarily change what the agency is doing, or it's not enforceable, but it does set a direction, and direction is important. Okay, so I want to come back to the tribe that we were talking about at the beginning with the mining issues. And so there's been a little bit of progress in this area. One of the pieces that's been really promising is a partnership between the U.S. Geological Survey and the tribe, looking at how to incorporate Indigenous knowledges into understandings of risk from uranium mining. And so there's this project that they've published a report now looking at conceptual risk frameworks and understanding from a tribal perspective what the impacts of uranium mining could be for people. And so incorporating these exposure pathways into future research and risk analyses will lead to results that are more inclusive of tribal resources and culture. And the final frameworks were presented in both English and in Havasupai, which aids tribal members in understanding how the findings relate to their community and helps to preserve the language and historical cultural practices for future generations. So one of the authors of the report said that it serves as an example for other tribal and federal managers who want to co-produce similar work, and emphasize that this is a culmination of 8 years of relationship and trust building, which is a really important piece of any work towards environmental justice, coming from non-tribal organizations or government agencies. That trust building is a really core part of being able to be effective and building those relationships. And so what this looks like, here's their final product. So conceptual risk models are a working hypothesis of how contaminants at a site might affect the surrounding ecosystem and the people that live there. So historically, model components might include the sources of the contaminants, the routes of exposure, endpoint receptors. Conceptual risk models for mining sites have typically been conducted from a Western science perspective and very focused on human health or ecological risk. But now we're able to have kind of an expanded view of what the meaning behind all of these different pieces. So it includes, from the Havasupai perspective, the health of relatives and residents of Mother Earth. The concept of water is life and healing. It includes gathering, hunting, medicines, cleansing and healing. So all of these pieces that are so important into that worldview include the environment, belief systems, food, ceremony, how all these pieces come together to create health for this tribe and for their people. And so then as we're looking at an exposure framework, that's kind of looking at how, if there are contaminants that are resulting from the mining process, how those might end up, how people might end up being exposed to those contaminants. What are the paths that they're taking from the mine into contact with people? And so this was really important to have tribal buy-in and involvement, because the tribe will use plants and animals in different ways. So as one of the elders said, the animals are going to get affected first by any type of environmental contamination, and then humans. So she said, in my community, we still hunt deer, we still hunt and eat rabbit, we harvest plants for various ceremonial reasons. And once they're affected, the chain of contamination will reach the human people. So our elders have taught us about the connection of the animal life, the plant life, the earth, all of these different connections that we have as Native people. So this conceptual risk model was basically telling the story of how the relationships between animals, plants, and water in the atmosphere are all connected. And so you can see how this includes a lot of the traditional practices and ceremony and all of the other pieces of how tribal members might end up being exposed to contaminants, and it encapsulates that worldview. So the U.S. still has a long way to go for environmental justice. The contaminant exposure framework is a positive step forward. It's a really good example of co-production of knowledge. And the application of that framework and other research can be used along with Indigenous knowledge systems in federal research and in decision-making for mining in the Grand Canyon region. And there is a lot more to be done there. So hopefully it will be used for further research, because the Pinyon Pine mine is still operating on an environmental impact statement that was created in the mid 1980s. So it is very out of date, and is really not inclusive of everything that it should be considering about the environmental impact. And it especially is not including anything from the tribal perspective of what the environmental impact would be. And unfortunately, that mine did become active in January of this year, despite decades of tribal advocacy strongly opposing it. So the tribe has said, you know, we've been at the forefront of opposition to uranium mining within our Aboriginal lands for generations. They've discussed the health risks and negative impacts and how it has disproportionately affected Indigenous peoples in northern Arizona, and said that they failed to listen to us, failed to support and recognize that all around this area, Red Butte and the mine site are our sites of cultural significance to the tribe. Not only did the mining company not recognize that, nor did the Forest Service, who is supposed to protect our sacred sites on public lands. Right, and so we see that that's kind of a failure to fulfill the federal trust responsibility. It's the failure of tribal consultation. It's a failure of the concept of free, prior, informed consent. Right, so all of those pieces that we said are on the path forward. We haven't seen them embraced in this case from the government in the way that we want them to be, but we can see how if we can move in that direction, we can see a real movement towards health equity and improving the health of tribes for generations to come. So that is my presentation. Thank you all for listening, and we can have some questions or discussion if anybody has questions or comments they would like to share.
Thank you, Miss Carrie. Like she said, this is the time for discussion and questions. So if you have any questions, please put them in the chat here. I do have some questions available, but I do want to give the opportunity for everyone else who may have questions to ask. So I'll leave the floor open for a few minutes, and then I will ask questions. Okay, well, I do have a few questions here. I'll just ask the first one. I'm pretty sure you already answered this question, Ms. Carey. But what would you say would be the primary challenges faced by tribal communities in regard to health equity, and how do they impact health equity, if that makes sense?
So really, I mean, health equity is so broad. Like, it includes pretty much everything, right, that impacts life. And so there's a lot of different types of challenges. I think a lot of it comes down to kind of threats to tribal sovereignty, or where tribes haven't been included in decision making and in policy creation. And so where we really see health equity actually, you know, being actualized and is where there has been strengthening of relationships between tribes and state and federal government agencies, and making sure that tribes are fully included at the table, and that consent is always kind of part of that equation when policy making is happening.
What would you say would be the barriers, some specific barriers to accessing like resources or services in tribal communities in regards to health equity? And to follow up that question, what would be the first resource that you would wish were available for these type of things?
So like barriers to resources.
Mhm.
I mean, it depends a little bit on kind of the context of which types of resources you're looking for. I think that in general, I'd really love to see a lot more of the kind of co-production of knowledge that kind of shared in the case study of the uranium mines in Arizona. More research and resources that really are inclusive of Indigenous perspectives and worldviews as um, government agencies are examining these different types of issues. And we've seen some progress. So the federal government did put out a policy on inclusion of traditional knowledge. And so there are some steps in that direction, but I think there's a lot of ways to go where there need to be more resources that are more inclusive of those tribal perspectives and that really show um, uh, kind of the different opportunities that are there that we might be missing if we're not listening to all these different Indigenous voices.
My final question will be, how can partnerships between the tribal communities and government agencies be strengthened to support and promote health equity? I would like to focus more about the importance of collaboration in this sense of this question, but any answer.
Yeah, I think relationships are really key. That we're not going to be able to really move forward without them. And so there's a lot of different pieces to that. It's making sure that tribes are always invited to the table and have the resources in order to participate meaningfully. Sometimes that has been a barrier. Making sure that, when there are meetings or consultations held, that they're held in a way that makes sense for the tribe to be able to realistically access them, right? So if all of your meetings are held in a virtual space, but the tribe that you're trying to communicate with doesn't have the strong internet access, right? That could be an issue. Or on the flip side, if it's in a location that's too far away from tribes and nobody can realistically drive there because it's hours away, then that's going to be a barrier to participation, right? And so a lot of building relationships is taking time to build trust, making sure that any project or research that you're doing is really only moving at the speed of trust, that you're building that relationship as you're trying. And that's kind of the first priority before any other of your project objectives. And a lot of that kind of comes down to how you're approaching the relationship and why you're there and being genuine, being open, recognizing from the government side, taking on a stance of cultural humility, recognizing that you're not going to be the expert. And so coming in with a stance of learning and humility when you're engaging with tribes is really kind of foundational to having a successful relationship there. And then to be able to grow that into different types of collaboration on any type of issue.
Well, those are all of my questions, and not seeing any others in the chat. Uh, Thank you, Ms. Carey, for your presentation. Thank you, everyone, for joining. That is the end of our presentation time. Feel free to fill out the evaluation that was in the chat so we can have feedback on our webinar series. You are all free to go. Unless you have other questions, then you can stay on, but I will be closing the meeting shortly. Thank you for joining. Have a great day.